This is Guardian Radio, your station for up-to-the-minute news and intelligent, interactive, and engaging conversations. 96.9 FM. The views and opinions of the hosts and guests are their own and do not necessarily reflect the views of the management and staff of Guardian Radio.
With early detection comes early prevention.
But letting your pencil make you feel like a champion.
Rise up again, let nothing keep you down. To live your best, hear the urologist speak. Oh yeah,
If a man don't give up on hope.
don't be ashamed. It's time to take control. Get some help from the urologist.
You will find
He'll help you solve your problems
on 96.9.
Yeah, I telling you, with early detection
Comes early prevention.
but letting your pencil make you feel like a champion.
Rise up again.
Pleasant good evening, Bahamas. This is the Urologist Speaks with Bahamian urologist Dr. Greggory Pinto. My co-host, Dr. Wesley Francis, is off island, so I'm in studio alone. We have a very interesting topic that'll spark a lot of debate, and it's going to be very, very important in improving the quality of life of many individuals, because there are several individuals who have the issue of the bladder controlling their life. So I'm going to do essentially part two, where we were discussing last week. We were very fortunate to have in the studio Mr. Eddie Carter, who suffered needlessly for many years with severe urinary tract symptoms, peeing frequently, urgently, not getting a good night's sleep, and negatively impacting his life. And he spoke about that. And he spoke about the minimally invasive procedure that turned his life around and now allows him to have control of his bladder and control of his happiness, and allows him to have a good night's sleep, allows him to drink freely without having to worry about where the next bathroom is. And unfortunately, there are still many men, women, and children that have the bladder control their life. So we're going to talk about essentially overactive bladder, and there are many forms of it. There's a lot of misinformation out there. First, I'm going to debunk a lot of myths that are out there. The first myth I'll talk about is urinary leakage or incontinence is a natural part of the aging process. Absolutely not. Of course, we're going to find as individuals, male and female, age, more and more of them for leakage or incontinence. But it's absolutely not something that you need to tolerate, and it's not something that is a natural part of aging. Your grandmother might have told you that once you reach a certain age, once you've had 2 or 3 kids, particularly if you've had vaginal deliveries, every time you cough as a female, every time you sneeze, every time you laugh, you can pee. And you don't have to live like that. That's a form of what we call stress urinary incontinence. Or your auntie might have told you that once you reach 40, anytime you have a glass of wine, anytime you have a cup of coffee, within 10, 15 minutes, you got to know where the next bathroom is. That's urinary urgency, where it's difficult to delay urination, where if you don't make it to the toilet in time, you're going to have what we call urge incontinence. All of them are going to severely negatively impact the quality of your life, because if every part of your life involves where is the next bathroom, and there are hundreds, if not thousands of adults in this country where they know exactly where every bathroom is or whatever island they're on. And that's a crying shame, because they have to live their life based on bathroom to bathroom. They can't sit down with friends, family, or work colleagues at a restaurant without feeling embarrassed, knowing that if they drink anything, even if they don't drink anything, they're going to be going incessantly to go to urinate. And it's going to be embarrassing because they notice that their colleagues, their friends, their family don't have to do that. And it's going to spark debate, and obviously they're going to maybe not say it up front, or you're going to have it in the back of your mind, what are they thinking? There's something wrong with me. And you're going to become a social shut-in. You're not going to want to go out. You're not going to want to be able to have a beer with friends and play dominoes. You're not going to want to have a glass of wine with your female friends and play cards or the latest gossip. And that's going to impair your quality of life. That's going to inhibit what you can do. And that's a crying shame. Nobody should have the bladder controlling their life. Another common myth and misconception that I'd like to talk about, number 2, is that only persons in middle age or only persons over the age of 50 are going to suffer from overactive bladder. Absolutely not. You have persons of all ages, even children, young children, on preteens, teenagers, men and women, boys and girls of all ages who can suffer from urinary incontinence. There are women who had kids at 20, and by the time they're 21, they're peeing, coughing, laughing, and sneezing all at the same time. They live their life on a pad, on a panty liner, where sometimes you might get lucky and you're only having a damp pad or panty liner, or sometimes it's soaked, but you basically got to live your life with a big purse because you got to keep changing that panty liner. You need to keep changing that pad. You feel embarrassed. You feel social. There's a perception that when you go around other individuals that you're smelling like urine. And how is that for a young person, or even a middle-aged person, or any person of any age, where you can't sit in church because you think that the persons around you in the pews are going to feel like you're smelling like urine, or you can't sit through a sermon or a church service without having to go urinate multiple times. And that becomes disruptive to you. That becomes disruptive to the service. You have to sit strategically in the back of the church, near the bathroom. You got to make sure you're on the end of the aisle. When you travel in flights and plane, even a short flight to Miami, you always got to book your flight early, and you always got to try to get a seat near the aisle, because you don't want to be climbing over an individual. Because let's say you're on a flight for 2 hours, you're going to New York for 3 hours, to Toronto for 3.5 hours. You might be going to urinate 5-6 times. You don't want to have even a glass of water on that plane ride because you're in and out of the bathroom, in and out of the bathroom. You go to urinate before you get on the flight. As soon as you get off the flight, you got to run to the bathroom, and throughout the flight, all you're doing is urinating. And that's no way to live. Another misconception or myth, I'll call it number 3, is that there's nothing that you can do. That overactive bladder, or having overactive symptoms where you may have irritative or obstructive urinary symptoms, there's nothing that you can do. It's something that's inevitable that you have to live with. Again, absolutely and categorically not true. There's so many things that can be done, and I'm going to speak about that. I'm here alone in studio. I'd love to hear what other persons are going through in terms of the bladder controlling their life. You can call us at 323-6232 or 325-4316 or 326-4259. So essentially, I would say 1 in 4 to 1 in 5 women in this country are living on a pad or a panty liner. And they do that their entire life. How are they going to become sexually intimate with their partner? How are they going to, even if they're a younger person or even middle age or whatever age, dating someone and trying to get to know someone and always worried about not being able to sit down and have a conversation with somebody for even 40 minutes because you got to keep going to pee, or always feeling like you're going to smell like urine, or a woman always worrying, what am I going to do with my pad? Is my pad soaking? Is it damp? What am I going to do when I become intimate? Women are terrified of even being intimate because they know when they have any pressure or exert any intra-abdominal pressure or during intimacy, they're going to leak urine, and that could be exceedingly embarrassing, particularly if it's a new relationship. So for some women, they just stop dating. They stop relationships. They stop being intimate. They stop going out to restaurants. They stop socializing. They stop going to the gym because they know that every time they go on the treadmill, every time they go work out, every time they're doing any exercise, they're going to be leaking urine. They don't want to play tennis because they know they're going to be soaking their pad or their panty liner. And then that's going to be hazardous to your health because you're going to be putting on weight. You're going to become depressed. You're going to become a social shut-in. I've seen individuals who have suffered with severe overactive bladder where they've lost their jobs. They just can't cope. How can you be in a meeting where you got to urinate all the time? How can you go from place to place where if you're stuck in traffic, you're in big trouble? And I've spoken about this many times. The abnormal, unfortunately, has become normal for too many people, and you're tolerating things that cause you to lose your dignity, your self-respect. Men driving with a container where they've have to urinate into. Men sleeping with a bucket, or even women sleeping with a bucket on the side of the bed because they're just too tired to try to get up to have to urinate 8 times in the night. It's a terrible situation, and you should never be embarrassed. You're completely not alone. It's inevitable as you get older that men and women are going to have some form of urinary issues. And if it starts at young, if you're 4 years old, you're 5 years old, and you have to pee all the time, and it's interrupting the quality of education that you're receiving, and that every single period you have to ask the teacher to go and urinate, or if you're 7 years old and you're always having to urinate on yourself because you're not, the teachers get fed up and doesn't want you or doesn't believe you have to urinate so frequently, you can be cast a judgment from your colleagues, your work friends, your classmates, and it can affect your self-esteem. I've spoken again many times about the condition of nocturnal enuresis, which is bedwetting. You're 10 years old and you're wetting the bed every single night. Your parents, your grandparents, or whoever you live with are getting up every night to wash the sheets. You're sleeping on plastic. You always feel like you're smelling like urine. No one wants to sleep over with friends. You can't go on trips or field trips with friends or classmates abroad because you can't be in a hotel with them and you're urinating all the time. There are things that can be done if you seek this consult of a urologist where you can stop the wetting altogether. So anyone over the age of 6 years old who is wetting the bed shouldn't have to live with that ordeal. And the parents shouldn't have to live with that ordeal because it's when a child is forming their self-esteem, when they're forming their personality. Why do you want to have that tragedy of wetting the bed every night affecting who that person becomes, affects their self-confidence, affects the number of friends that they can have. It affects them even academically because they're always fatigued because they have to wake up all the time because they're always wet. They're afraid to even sleep. It can become even almost developing a form of post-traumatic stress because the parents obviously in many cases are going to blame, and this is something that I will not blame the child. It's not laziness. It's not being naughty. It's not looking for attention. It's because there's a disconnect between the brain and the bladder when you're asleep, and it doesn't allow the child, to wake up when they have to urinate, and they're just going to automatically wet themselves. So blaming the child is absolutely the wrong thing that you need to do. You need to seek help for them that can turn the tide, even in one consult from a urologist. I'll see a patient who might be 15 years old. They were wetting the bed every single night for 9 straight years. We do a thorough history. We make sure that they don't have anything such as spina bifida occulta, which is a congenital condition that affects the nerves. We make sure that they're emptying the bladder completely, ensure that constipation is not causing this problem in some way, because if you have a rectum full of stool all the time pressing on the bladder, that can cause daytime and nighttime urinary urgency and leakage as well. But if it's just primary nocturnal enuresis that you can be dry for the first time in months or years, whatever time you were suffering from the bedwetting, and going forward, usually a child will grow out of it as they get older in their later teen years. So why does someone who's been suffering from bedwetting from the age of 6 or 7 have to wait till they're 18 or 19 to grow out of it when we can give them a simple medication that they can take before they go to bed and they can be completely dry so the parents can get a good night's sleep, so the child can have their self-esteem again, where they can get a good night's sleep, where they don't have to be worried about waking up in a puddle of urine all the time. And for many kids, they have younger siblings who do not wet the bed. So you can imagine the younger child, might be 8 years old, teasing the 15-year-old big brother or big sister. It's a horrible ordeal. It can be a depressive event. It can be a monumental event that shapes the entire future and personality and self-esteem of that individual. Please do not, suffer with bedwetting. Even there are older persons who suffer with bedwetting. There are many reasons for that. So every individual is different. So just because you have urinary issues, whether you're male or female, it doesn't mean you have the same condition or even conditions that your aunt has or your grandmother has or your sister has or your friend has. So we need to ascertain why you're not emptying your bladder. Is it an issue where there's an obstructive cause where you're not emptying your bladder? Is there a non-obstructive cause? Is it because that the bladder receptors within your bladder are hypersensitive? So a bladder reaches a certain threshold in terms of volume of urine when it's filling up that will tell an individual, oh, you need to go urinate. That might be when the bladder is a third full. That might be when the bladder is a quarter full or half full. But for some individuals, they may have a 5% full bladder in terms of capacity or 10%. And because of the hypersensitivity of the receptors in the bladder, they're going to feel that urge to have that big, because they cannot delay urination because they're going to wet themselves. And then they go there and it's a little trickle. And we do investigations. We'll do an ultrasound to determine what we call a post-void residue. We'll have you drink a lot, make sure that you fill your bladder. We measure the capacity of the bladder. Then we ask you to go and empty your bladder completely. Then when you think you've emptied your bladder, we ask you to go again and make sure everything is out that you can get out. And then we measure and determine quantitatively, is there a severe problem in terms of how much urine is left behind? And if there's a significant amount of urine, then we need to determine why there's a significant amount of urine. 1 in 7 adults in this country have either diabetes or are pre-diabetic. Unfortunately, so many individuals, even when they're given the diagnosis of diabetes, do not accept it, do not make any behavioral modifications. They're still eating the same horrible diet. They're still not taking the medications. They're not following up with their GP, their family medical practitioner, or their internist to make sure that the diabetes is. And the diabetes plays havoc and eats the individual from the inside out. And one of the first things they're going to find is it's going to affect the nerves. And it's going to affect the nerves that allow you to have a proper bladder filling sensation. It's going to affect the nerves that allow you to have proper motor motility that allows you to contract and empty your bladder. So individuals who are poorly controlled or undiagnosed diabetics often have a condition called diabetic cystopathy, where the nerves that allow you to feel when your bladder is full are impaired. The nerves that allow you to contract your bladder and empty your bladder are impaired. And essentially, you can be walking around with a full bladder, and when the condition is severe, you don't even feel like you have a full bladder. What's the consequences of that? Your bladder can only take so many knocks. It can only expand to a certain size. It can only be placed under so much strain over so much time before you develop acute kidney injury, where you're going to have back pressure on your kidneys, where you're going to develop renal insufficiency, and if it becomes, you can develop chronic renal failure. If you have uncontrolled diabetes, you're already at risk for developing renal failure. So please eat right. Make sure that you have exercise in your weekly schedule. Make sure that you try to maintain a normal body mass index. Make sure that you go to your annual physicals and know your numbers. Know what your HbA1c is. That determines how well your body has dealt with sugar, glucose in the last 3 months. Is that HbA1c telling you you're pre-diabetic? Is it telling you that you're diabetic? And if you are diabetic, how poorly controlled are you? And that gives us a gauge for the patient and for the physician in terms of trying to fine-tune your diabetic or glucose control so that you can have a normal life going forward. There's a strong link between sexual dysfunction for men and women and diabetes. So even for men, who the most important organ in their body, and I'll always preach that, is being able to rise in the fullest glory whenever the need. Diabetes is going to rob you of that. Even if the little blue pill or the Cialis or the Viagra or the supplements that you get from the gas station, which you shouldn't be getting because they're not FDA approved, and you take them at your own risk, they may have active ingredients of Viagra or Cialis, along with a lot of other things that can be very harmful, including lead paint chips or sawdust. They're made very cheaply because it's $1 billion business. They just want repeat business. They don't care about the individual. And all you're doing is delaying the inevitable, because if you have uncontrolled diabetes affecting your ability to empty your bladder, if you just live your life where's the next bathroom, you're not treating the root cause. If you're letting diabetes destroy your sexual life, your erectile function, allowing you, even women, it can affect your sexual function in terms of being able to achieve an orgasm or enjoy sexual intimacy as well. All you're doing is not recognizing that something early is going on, and it can stress if you allow it to continue, because it can develop kidney failure, it can affect your heart and cause irreversible damage, it can affect your eyesight, it can put you on dialysis. So an individual who doesn't want to see a doctor in their lifetime ends up having to go on dialysis. They're going to be seeing a doctor their entire life. Their quality of life is going down drastically. They're going to be having to get an AV fistula. They're going to have to be able to wait on a waiting list for a kidney transplant. So listen to your body. Please get your annual physicals. Let's be not only preventative and proactive, but even if we do pick something up, let's pick it up early and address it. And if you're told you have diabetes, if you're told you're hypertensive, please accept it. We're not going to diagnose you with these conditions or prescribe you medication unless it's 100% certainty that you do have these conditions. If your blood pressure is high on one occasion, that's not enough to diagnose you with high blood pressure. Many individuals will say it's the white coat syndrome. When I come into the doctor, my blood pressure goes up. That maybe it might go up marginally, but when you have a blood pressure of 225 over 120, where we almost have to send you to the emergency room because you're probably going to have a stroke or a heart attack, you cannot explain that away by white coat syndrome or anxiety, or the salt that you had with your scrambled eggs that morning, or the fact that you had to run up the stairs earlier before you went to the doctor's office. Studies have shown conclusively that the blood pressure machines that you use at home are notoriously unreliable. They can be off by 15, 20 millimeters of mercury. So always recognize that the very expensive and often calibrated machines that are used in doctors' offices or in hospitals are the accurate reading. And please accept that. So, okay, doc, I admit I have high blood pressure, but I stopped taking the meds because I don't feel any symptoms. You don't feel any symptoms until disaster is going to affect. High blood pressure is the reason. So if you want to live in ignorance and then you drop dead, or you have a stroke, or you have hemiparesis for the rest of your life and you become a burden to your family, why? Because you didn't address the fact that you did have high blood pressure. Okay, doc, I admit I have diabetes, but I stopped having so much sugar. I'm walking on R&B Bailey Park, so I don't need to take my diabetic meds. If you have diabetes, particularly if you have insulin-dependent diabetes, or even if you have non-insulin-dependent diabetes, if there's an issue with the pancreas and the formation of insulin, you can help the control of your diabetes by having a perfect body habitus, by eating right, by exercising regularly. But if you need the medications, you need the medications. And please recognize that fact. There are too many individuals in this country who live by Google. Google is their doctor, and they're going to put their entire life and their health in the hands of reading something on the internet. There are many false informations out there on the internet. All right, so we'll continue this talk on the other side of the break. This is Urologist Speaks with BAME urologist Dr. Greggory Pinto.
Reliable and impactful printing services, look no further. Let Printmasters bring your masterpiece to life. We stand by our quality products that is second to none. Our affordable pricing and friendly, efficient staff makes Printmasters the ultimate choice for all your printing needs. We can deliver any type of printing services, from banners to booklets to business cards. You name it, we can print it.
Let Printmasters bring your masterpiece to life.
Located in the Nassau Guardian Building, telephone 302-2361.
Girl, Junior just showed me Bella Boy in his phone.
What you mean? He take picture of that good-for-nothing boy?
Shh, you don't want Bella here. You say that. You know she always say that's my good child.
So what he doing in Junior phone?
Oh, he acted less.
Wanted persons in your phone now?
Yes, child. And when police want to find anybody quick, after something happen, they can send picture direct to your phone. Go to Google Play or App Store and search for Crack Crime Bahamas, then pick install, and it will go straight to your phone.
There is also a section on missing persons?
Yes, girl. Everybody needs to get this app so police can tell us right away when these people go missing. Just like an alert system.
Yes, it has numbers for Crime Stoppers Bahamas, so you can call and nobody knows it's you. Call directly to Miami and give the information without giving your name or anything about you. I tried the other day, and when I hear Junior and his boys talking about where they hide those guns, I walk quick round the corner and call that number.
Call 328-8477 from Nassau or 242-300-8477 from the Family Islands.
Everybody Wins Live is bringing you the ultimate giveaway, a brand new Cybertruck. For every $30 spent, you're in the drawing for the ultimate grand prize, a Cybertruck. Join live at the Vibes Cartel concert March 29th. You'll also be automatically entered to win tickets to see the world boss himself. 25 lucky winners every single week. EverybodyWinsLive.com to get into the game. See website for full terms and conditions. Must be 18 or over to participate.
Love the show? Want to give your support? Become a sponsor today. Call 302-2300 for our rates and packages. That's 302-2300. Become a sponsor on Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
This is Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
Welcome back. This is Urologist Speaks. We're talking about overactive bladder, letting your bladder control your life and trying to get back control of that bladder. So I have a text message coming in. Are the shows recorded? Where can I find last week's show? So starting in August 2024, when I started doing the weekly The Urologist Speaks radio show on Nassau Guardian, all the shows are readily available on Spotify. So you just need to search The Urologist Speaks with Dr. Greggory Pinto. So every single week is available. In fact, the shows on Wednesday are available on Spotify the following day, Thursdays by 12 noon. I also have a Facebook page, Urology Care Bahamas. To the Spotify radio shows are readily available the next day on my Urology Care Bahamas Facebook page. All right, so how do we control overactive bladder? And I can't emphasize this enough. You always find out what is the root cause. Sometimes it's more than one cause, and you treat the root cause. You don't just treat the symptoms, you treat the root cause. If you're treating just the symptoms, the root cause is going to cause those symptoms to get worse and worse, and whatever medication that may have been working will become less and less effective and then become completely ineffective. So you're just going to let a small problem mushroom out of control and become a worse problem that could have been treated in the acute phase when it was early on. And by the time you have severe symptoms, a lot of times there's been irreversible damage to the bladder. The bladder will never function like it should. Sometimes you've developed renal failure and you'll never have normal renal function again. So never let that happen. You shouldn't live with that indignity. We only have one life. Let's live the best. Why live with the indignity of driving with a container to urinate into because you can't even pull over the side of the road? Why live your life on a panty liner or a pad or worse yet, an adult diaper, where you're going to have poor self-esteem, where you're going to feel like you're smelling like urine all the time, where you're not going to want to be around individuals, you're not going to want to exert any effort. That means you don't want to exercise because you know you're going to be smelling like urine all the time. Stop it. We can help you. The help is here. There's no embarrassment in seeking help. The real tragedy is to continue to live your life where you're not really having a life at all because the bladder is controlling your life. Living to bathroom is controlling your life. Having sleepless nights is destroying the quality of your life. It's reducing your lifespan, because if you're not getting 7 hours of good quality sleep, you're going to significantly reduce your life on this earth and the quality of life on this earth. So if God only gave us one life, let's live the healthiest life possible, and that emotionally, spiritually. If we see someone else suffering that we care about, and we should care about everyone, please reach out to them and encourage them to seek help and make them realize that they're not alone. Speak openly with your friends. If you tell them that, you know what, I'm tired of waking up 4 or 5 times in the night to urinate, I'm sure several of your friends, if you're speaking in the group, are going to say they suffer from the same things. So first thing, you're not alone. There's always going to be a solution. Even when I talk about, as urologist, I speak about erectile dysfunction. No matter what the problem, you can always rise again. You just need to seek help. The same thing when it regards to your bladder. If your bladder is controlling your life, or your prostate is controlling your life, and you're having urinary issues of frequency or urgency, or never being able to empty the bladder, whether it's daytime, nighttime, or both, you can seek help. The first thing we're going to do is we're going to determine the root cause of that problem, and then we're going to treat the root cause. We're also going to do behavioral modifications. Sometimes the problem is what you're doing. If you're having 8 cups of strong coffee every day, caffeine is going to cause you to want to pee all the time, urgently and frequently. You're not going to get a good night's sleep as well, so you're going to be peeing all of them through the night. There are too many of us who are having Lipton tea just before they go to bed and want to know why they're waking up at 3 o'clock in the morning and they're staring at the walls and feeling so stimulated, and they can't go back to sleep, and then living their whole life throughout the day like a zombie. Or they want to know why they're peeing all the time when they're having this caffeine and this Lipton tea. Or they have the routine of having a strong cup of black coffee before they go to bed. And when they wake up, because they're so tired, they need to have black coffee throughout the day, which causes them to pee in frequently and incessantly throughout the day as well. So please stop it. If you're drinking too much, what is the correct amount to drink? Obviously, every individual is an individual. Everybody has a different weight. Everybody has different medications that may be causing them to pee. For example, diuretics or certain high blood pressure medications can cause you to pee frequently. And for many persons who are on certain blood pressure medications, you don't necessarily need to be on those blood pressure medications. There's so many classes of blood pressure medications, and there's no one medication that's only effective for you. If it's causing horrible symptoms, there's some medications that cause you to cough all the time. Some individuals will start a high blood pressure medication and want to know why they have this nagging cough all the time. They're taking antibiotics, they're using lozenges all the time, they're using cough syrup, and they just can't understand why they don't get rid of this cough. And the cough is caused by the blood pressure medications. There's some individuals where that blood pressure medication might be causing them to pee frequently all the time, and it's not a necessity that they need to be on that medication. So we can change that medication to one that doesn't have you peeing all the time and allows you to have a fine-tuned control of your blood pressure as well. So we always have to look at what medications that you're on. Some persons have swelling of the legs, and some physicians it's related to a condition where they may have congestive cardiac failure. In many cases, it's not even related to that. They have venous insufficiency, where the blood that goes down into the legs is impaired and coming back via the venous system up to your heart. So you're going to have pooling of blood in your legs is going to cause swelling. Characteristically, a lot of individuals will put their legs up and they know the swelling will go down. Or they'll know that when they sleep or even have the legs elevated, not even elevated, the swelling goes down. And as they walk or throughout their day, they know the swelling comes back. So you can take all the Lasix in the world, and that's not going to improve your venous insufficiency. So just because you're being put on a medication, you might have needed Lasix 6 years ago. It doesn't mean you need to take it for the rest of your life. So even if you're on a certain blood pressure medication at a certain dose, it doesn't mean you need to be on that blood pressure medication for your entire life. Or if you're on 2 blood pressure medications, it's very common for you to be changed to a different medication or a different dose, or to be changed from 1 blood pressure to 2, or from 2 to 1. So that's why you always need to see a physician. If you have high blood pressure or diabetes, you should be seeing a physician 2 or 3 times a year. That's the wonderful thing about NHI. Economics plays no role. You can see these physicians in a private, quote unquote, manner, get your investigations done, get your bloods done for free, get the medications for non-communicable diseases for free. So there is absolutely no excuse that you don't have half an hour or 45 minutes to dedicate every 6 months to your health, to your well-being, to the betterment of your family, because if you become ill, you can become a burden to your family, and it can become an expensive burden as well. Cancer that can be picked up early and given a very effective cure cannot be the case if you do not get it picked up until 5 years too late. And all we're doing is trying to give you time on this earth by giving you palliative care. So please listen to your body. In many cases, prostate cancer, for example, has no symptoms until it's too late. Blood pressure is a silent killer. You're not going to have any symptoms until it's at an nth degree or severe stage. Diabetes as well. So let's pick up early with just simple blood tests, investigations, by seeing your primary physician, or you can see your urologist. I do annual physicals all the time. So you go with who you feel comfortable with. You need to develop a rapport with your physician where you can trust them, where you know within the confines of that office that whatever you speak to them about, that it stays in the confines of that office, and they're going to dedicate the time to try to get a better version for you, and that they're not going to judge you. They're going to be supportive. Obviously, they're going to have complete confidentiality. That's the cornerstone of any good physician's practice. And you shouldn't be afraid to tell a urologist that, you know what, I'm frustrated because I'm suffering from premature ejaculation in 45 seconds. We can help you. You shouldn't be frustrated that you're embarrassed to tell any physician that you have to wear a panty liner and you got to change it 5 times a day because it's either damp or soaked, and it's become an economic burden on you, and you're feeling embarrassed because you smell like urine all the time and you don't want to be intimate with your husband anymore. I've seen individuals lose their job because of the bladder being such a severe case of overactive bladder. I've seen individuals lead up in divorce because of the bladder controlling their life. I've seen persons not progress in their profession because their bladder has impeded them from being successful at work. So don't allow your bladder to affect your child's education. Don't let the bladder allow you to control your happiness, your social activities, your professional life, your marital life, your family life. There is absolutely no need for that. So there's so many things that can be done. If you have incontinence, we can prescribe Kegel exercises. There are wonderful physiotherapists who can put you through pelvic floor physiotherapy, who can in detail determine the strength of the pelvic musculature. So once you have one child, at no matter what age, you're going to be at risk of stress urinary incontinence. Once you have 2 children, particularly if there's a prolonged vaginal delivery, you're going to be at risk of having urinary incontinence. Losing weight is going to help. Medication are very effective for individuals if we determine the root cause of the problem. If you have primary overactive bladder where you're emptying your bladder, we can prescribe you things like anticholinergic, antimuscarinic, newer drugs like beta-3 agonists, which are very effective, which block the receptors that prevent you from having that overactive bladder. So you can be on a medication that can stop you from peeing 3 times every hour and 8-10 times at night, and you can go 4 hours and only empty your bladder when your bladder is actually full. You don't have to worry about drinking something. I am tired of hearing individuals say, you know what, doc, I pee 3 times in the night, but I got to stop drinking at 5 p.m. or 6 p.m. Because if I drink anything after that, I'll be waking up 8 times, and I just can't live my life like that. My wife is fed up, or my husband is fed up because every time I wake up to pee, I'm waking them up. I can't get back to sleep, and every time I get back to sleep, I got to go and pee again. It's just basically destroying my life. It's destroying my marital life. It's creating marital discord. No one should have the bladder control their life. I can't emphasize that enough. And there's so many individuals, maybe 1 in 3, 1 in 4 adults of all ages in this country and throughout the world are allowing overactive bladder to control their life. Even in the United States, as many as 33 million adults, men and women of all ages, have some form of overactive bladder. As many as 1 in 3 women have an overactive bladder where the bladder controls their life. It's a tragedy of epic proportions. So even some individuals where they've developed irreversible damage to their bladder, for them to stay dry, we have to actually allow them and teach them how to do clean, intermittent catheterizations, which is not pleasant, but at least they have some semblance of normalcy because they don't have to live on a diaper or a panty light or a pad where every 6 hours, essentially, you go to the toilet, you got to put a catheter in and out, disposable clean catheter in and out, a small one, to once you think you finish your bladder, it'll completely empty your bladder. So that'll also help just before you go to bed, allow you to not wet the bed. It'll also help when you wake up where you're not worrying about when you're driving in the car to work or to wherever you're going that you're going to be leaking urine all the time or have to pee urgently all the time because you're not emptying your bladder. But we want to prevent you from going down to that road where you need clean, intermittent. There are wonderful advancements in overactive bladder in the last 20 years. That includes nerve stimulation. You can have tibial nerve stimulation, and this is going to sound strange, where basically we provide painlessly in the office over a period of usually about 6 weeks, 2 or 3 times a week, sessions where we stimulate the tibial nerve, and that's the nerve in the back of the ankle, the back of the foot, where we basically put in a little, it's almost, I would describe it as an acupuncture needle connected to an electrode that provides a painless stimulation, a nerve impulse. And how that works is when you have the tibial nerve stimulation, impulses travel to the nerve roots in the spine to block abnormal signals from the bladder and prevent bladder spasms and prevent overactive bladder. There's also nerve stimulators that you can actually implant. There's a tibial coin implant that we can place, or there's actually a sacral nerve stimulator that is implanted into your lower spine that prevents you from having the worst case scenario. Bladder Botox. You hear about Botox in terms of the vanity of fighting wrinkles and aging. We can place Botox in your lunch hour in a 15-minute minimally invasive procedure. There's no cutting stitches. Everything is done through a tiny little scope. You can even use a flexible scope. Looking up on the high-definition screen, magnified several-fold, we place Botox in 20 different locations, 100 units of Botox in 20 different locations. And what that does is it reduces hyperactivity of the bladder. It dulls the hypersensitivity of the bladder receptors. And it's highly effective. And what it has little to no symptoms. It's not a cure to overactive bladder, but essentially it can make someone who pees 5 minutes, 15 minutes, 10 times in the night, have a good night's sleep, maybe they wake up once to pee. Go to 4 to 6 hours without having to pee. So basically gives you back your quality of life. It will fade over to the end of the 6 or 9 months after the first procedure. Happy to get that 15-minute outpatient minimally invasive procedure that you'll go back in 9 months, or even some people get a year where they don't even need to be on any medication. Some of the medications, unfortunately, have side effects in themselves. They can cause dry mouth. They can cause blurring of the vision. Imagine if you have dry mouth. What are you going to do? You're going to drink more liquids and cause the problem to be even worse. It can cause headaches. So some of these medications are not very well tolerated, particularly for some individuals. It can cause constipation. And the constipation can cause the overactive bladder to get worse. So that's where first-line treatment is medical therapy with medications. But if persons who are ineffective treatment from the medications, or the medications have severe side effects, Botox is a wonderful minimally invasive modality that gives excellent results. It's widely used, and I do Botox for patients every single week. And I've never had anyone complain, and I've always had glowing reports. I've had patients cry with happiness because all of a sudden they're have control of their bladder, whether they're male or female or even children. For the first time in their life, they don't have to worry about smelling like urine. For the first time in their life, they don't have to worry whether they're male or female with being sexually intimate and worrying about urinating all the time or feeling like they have to urinate all the time. They can drive in the U.S. from state to state and not have to worry about where the next bathroom is. They can have liquids up to 10 o'clock at night just before they go to bed and not have to worry about waking up all night to pee. So it can change their life drastically from darkness to light. And there's always some way that we can get you back control of your bladder. So as I said, never let bladder control your life. Prolapse is also another common problem for women as they get older. So we'll talk a little bit more about prolapse on the other end of the break. This is Urologist Speaks with Dr. Greggory Pinto.
Everybody Wins Live Away, a brand new Cybertruck. For every $30 spent, you're in the drawing for the ultimate grand prize, a Cybertruck. Drawing live at the Vibes Cartel concert March 29th. You'll also be automatically entered to win tickets to see the world boss himself. 25 lucky winners every single week. Visit everybodywinslive.com to get into the game. See website for full terms and conditions. Must be 18 or over to participate.
Great is thy faithfulness, O God, my Father.
Hello, I'm Simeon Hall. I grew up through a dead-end corner called Chokeneck Alley off Market Street. I dropped out of school in the 5th grade and worked as a carpenter's helper for McAlpine Company. But it was while in the alley I discovered my life's calling was to preach the gospel. A Catholic nun at Aquinas night classes inspired me when she told the class that we all were made in God's image. It's a long way from Chokeneck Alley to preaching throughout the Bahamian and all the inhabited continents of the world. The circumstances of your birth need not dictate what you can do or where you can go in this life. Young man, drop your gun. Find your life's highest purpose. Lift yourself from the gutters of crime. Your next crime might lead to your death, and loved ones will have to bury you. Eternity is just ahead. In which section will you spend it? Non-smoking or smoking? Heaven or hell? You are made in God's image. So this week, attend a church of your choice and reconnect with God.
Love the show? Want to give your support? Become a sponsor today. Call 302-2300 for our rates and packages. That's 302-2300. Become a sponsor on Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
This is Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
Welcome back. This is Urologist Speaks with the urologist, Dr. Greggory Pinto. We're speaking about the bladder controlling your life, overactive bladder for men, women, and children, regaining control of your bladder, regaining control of your happiness, living the best quality of life possible, and not letting the bladder interfere with that or impair your sexual happiness, your professional success, your educational success, your social interactions. So I have another text coming in. Hi, Doc. 6 months in from prostatectomy. Urinary control within 3 weeks. But I do have urinary urgency. I'll be fine for hours, but the minute I get home, I have to sprint to the bathroom. Also, erections have not returned yet. How concerned should I be? So every individual is different. I'm assuming when you talk about prostatectomy, you're talking about a radical retropubic prostatectomy for cure of prostate cancer, because you also have simple prostatectomy, which is rarely done now. That's for a very massive benign disease. Usually we can manage most patients with massive benign prostate hyperplasia minimally invasively without actually doing a prostatectomy. But anytime you have a radical prostatectomy, unfortunately, you can have some element of neuropraxia that can impair the nerve supply to your male member for you to be able to achieve and maintain an erection. We always talk about life over limb. That's why we are always preaching, please let's pick up prostate cancer early, because if we can pick it up early, the cure options that we have would allow us to have minimal to no side effects. So we try for the trifecta. Anyone has prostate cancer, you want to make sure that you're in cure and that you're not going to have recurrence. We want to make sure that you don't have any urinary issues, such as incontinence or urgency after the procedure, and that we also want to make sure that your erections are going to be the same before and after the procedure. But we always talk about life over leisure. If the prostate cancer is enveloping or encroaching upon the nerves that allow you to get an erection, we're going to take the nerves. We're going to disrupt those nerves, even if that's on one side or both sides. So that's going to impair your erection. We can deal with the erections later when you're alive and you have that prostate cancer cure. So even the mechanics of the radical prostatectomy, there's often some stretching of the nerves. We it's sparing, but even then, you can have some neuropraxia. So you may not have full regain of your erections for up to 6 to 9 months. But what you should be doing is to allow the blood supply to maintain to your male member is to be taking, for example, a daily Cialis, or the generic is Tadalafil, which is much cheaper and exactly the same, 5 milligrams once a day. When you have urinary urgency, that could be for many reasons. You want to make sure that you are, in fact, emptying your bladder, because you can develop a urethral stricture months or even years after you've had a radical prostatectomy, which will inhibit and create an obstruction to you emptying your bladder. You can develop a bladder neck contracture, which is a scarring at the opening of the bladder. That can also prevent you from emptying your bladder, where you have that urgency because you're really never emptying your bladder. You may also have issues where your external urethral sphincter is weak. So we need to ascertain what is the reason for it. Is there an obstructive cause, or is there a non-obstructive cause? Is there a weakness of your pelvic musculature? Is there a weakness of your external? In cases, if there is no obstructive cause, we can provide you with medications such as beta-3 receptor agonists, such as mirabegron, that allow you to not have that urgency. So you don't have to run and fumble with your keys and you're wetting yourself before you make it to the toilet. You don't have to worry about urgency when you're driving or out, etc. So obviously we're trying to provide as much information and encourage persons to seek help, but obviously I can't diagnose you based on a text, and I can't provide a cure for you over text. So my advice to you is seek a consult of a urologist, and we can definitely get you on the road to getting your erections back on track. Even if your nerves are impaired, as I always say, you can always rise again. There are things that we can do and provide for you that allow you to get a very good quality erection, even if your nerves are non-functional, even if the blood supply is very poor to your male member. And we could also do things to make sure that you know what the circumstances is. So I'm glad you had the radical prostatectomy. You didn't mention whether you are in a curative state. I'm hoping that you are, but do not continue to suffer needlessly. There are urologists readily available in this country that can provide you improved quality of life by getting your erections back on track and treating you and giving you proper management for your urinary urgency. So when we talk about treatment, we also talk about behavioral modifications. And individuals always want to say, what is too much? You shouldn't have to urinate more than 8 times a day. You shouldn't have to wake up to urinate more than twice a night. And some will say even more than once a night. But we also have to look at the amount of fluids that you're taking, the volume. So we always ask an individual to do a bladder diary. What volume of fluid are you taking in? Which liquids are you taking in? Which of them have caffeine? Which of them may have a diuretic effect, whether it's alcohol or caffeine? Chocolates also have caffeine in them. Some individuals are very hypersensitive to certain things in their diet. So we can pinpoint bladder irritants, and some common bladder irritants would be caffeine, as I mentioned, alcohol, soda, carbonated beverages, citric acid. So whether it's food that have citric acid or drinks that have citric acid, you want to limit that intake as well. You want to lose weight, because just being overweight or obese, studies show that losing just as little as 8% of your total body weight can increase the incidence of urinary frequency and urgency dramatically. Stop smoking. You shouldn't be smoking anyway. Smoking causes heart disease. Smoking causes innumerable cancers. Smoking is a very selfish thing. We're talking about nicotine smoking and cigar smoking because there's secondhand smoke. So you're putting all those around you at risk. That nicotine, that smoking permeates your skin, your clothes. So you're going around your children, you're going around your loved ones. You're putting them at risk of cancers. You're putting them at risk of increased heart disease. Stop peeing very frequently and urgently as well. Manage your constipation. There are too many individuals in this country who silently do not deal with their constipation. And we spoke about it a few weeks ago in terms of colon cancer, it being Colon Cancer Awareness Month in March. If you're constipated, I'm not talking a one-off thing, but you're constantly constipated, or there's a change in bowel habits where you're having diarrhea, or you're not passing stool for 4 days or 5 days, having abdominal distension or discomfort, seek the help of a gastroenterologist. They're readily available to help you. But constipation can also cause you to have urinary urgency or frequency, because anatomically, as I mentioned earlier in the show, the rectum lies right underneath the bladder. A rectum full of stool is going to be putting an extrinsic compression on the bladder. So anything within the pelvis, whether you're a male or female, that put pressure on the bladder can cause you to pee frequently. That includes uterine fibroids. So for women, particularly younger women, if they're peeing frequently, the first thing you want to rule, do you have a uterine? Do you have constipation where the rectum full of stool is pressing on your bladder? We also want to rule out, for example, even women obviously know if you're pregnant, you're peeing all the time. That's because your uterus is obviously distended because of the pregnancy as well. So every individual is different. We need to determine why you're peeing so frequently or so urgently. But the take-home message, as I'll always say, is there's always a solution. There's always a cure if we can treat the root cause. Stop using Google as your doctor, and please stop this embarrassment. The real embarrassment is stopping going to the gym, you stopping from going out and socializing, you having to wear panty liners and pads and buying them wholesale because they're so expensive. That's absolutely ridiculous. Live the best quality of life possible, because you only have one life to live, and the best life possible that God gave us. We spoke about benign prostate hyperplasia last week, both getting older. In terms of the likelihood and statistical probability of it happening, about 50% of 50-year-olds, 60 to 70% of 6-year-olds, 70% or more of 70-year-olds are going to have some obstructive or irritative lower urinary tract symptoms. When they're not emptying their bladder, they're going to have a weak urinary flow. They may have urinary hesitancy. It may take them up to 45 seconds to just try and initiate a stream. Men who it's now become their norm where they actually have to sit on the toilet to try to pee because they have to use every intra-abdominal muscle just to try and empty their bladder. They know they're not emptying the bladder. Every time they try and pass stool, they know they're leaking urine in uncontrollably or with incontinence, because every time they put any pressure down on their increase in intra-abdominal pressure, they're going to leak urine because their bladder is always half full. Okay, we have a call coming in. This is Urologist Speaks. Good evening.
Yes, good evening, Dr. Pinto.
How are you doing?
It's always good. It's a pleasure to listen to you. And so I would just like to back up as to what you're saying. You know, a lot of people think, like I know, but you know, being very terrifying, as I've learned from you, right?
Yes.
And so I listen to you, and so you're reliving my nightmares, right? But as it relates to the incontinence, post-surgery, you know, because the bladder muscles is weaker, you know, the prostate, I had to reach the turf, right?
Yes.
And so I realized that I couldn't, you know, the muscles was weak. And you regain. I learned how to retrain the bladder.
Yes, sometimes you need to have pelvic floor physiotherapy, particularly if you've had symptoms for a long time. And I always say, in layman's terms, your bladder's taking a lot of knocks. Your bladder is irreversibly damaged. And even if we remove that obstructing prostate, your bladder is not going to function properly for you to empty your bladder completely.
I'm almost a prostate specialist, but listening to you for another, you know, listen, doctor, something you said last week to me was very profound. So, you know, I had stopped, I don't cross-medicate, right? But as it relates to the Abadat, how long should I be up that before I go get because I want to get a PSA test anytime this week or before, like, the month end. Like, how long do I need to be up that before I take, because you said it would more or less impede the real PSA results. How long I need to be up that.
Yeah, so if you've been on Avodart for more than 6 months, there's no need to take you off it to take the PSA. You just have to be mindful, and your physician also has to be mindful that whatever value you get, you just double it. It's simple as that.
All right. yeah. Well, I guess you. But the thing is, as it relates to the peeing after the TERP, right?
So everything is different. So unfortunately, in the public system, and we did change this, I was able to get a modern. We've got a laser machine through the United States Armed Forces. I had to write 25 letters.
Donated it?
It was donated free of cost.
Right.
So we have the state-of-the-art laser machine. We have the state-of-the-art bipolar transurethral resection. So for years we had the monopolar TERP machine, which is antique. In many places in the world, it doesn't even exist.
Yeah, but what I'm saying is because the TERP, the old one was kind of outdated, but the pain that you actually felt now that you have it updated is good, because the pain that you felt, the burn, like my eyes would open like this, and the painkillers did nothing for that, and that was very, 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 very terrifying.
Yeah, that's one of the reasons the monopolar TERP is outdated, because of the side effects of it, the fact that you can develop what we call hyponatremia, hypodilutional natremia, where the sodium levels can go dangerously high. Dangerously low, I apologize, where it can cause cerebral edema. You can end up in ICU, can be life-threatening. So if you have a huge prostate, you need to stop at 1 hour, because the irrigating fluid that we're using, whether it's glycine or sterile water, can lower your sodium, and it can be life-threatening. So no matter what, sometimes you have to come back several times with the monopolar TERP. But the bipolar, you can resect for 3-4 hours without the issue of the sodium going low, and you can send somebody home right away with their water, with the urine looking like aquapure water. So that's the advantage.
And so I was trying to remember too. Wearing the catheter, I did it for an extended period of time, and I think that how does that relate to the stricture? Like they said, if you wear it for a certain period of time, it could be.
No. So anytime you have any instrumentation, anytime you have a catheter, unfortunately, sometimes for example, catheter is removed by a nurse or someone who doesn't understand that. Usually, for a normal catheter, you inflate a bulb. A bulb is like an anchor, so that when you walk around, it doesn't fall out. You put in 5 mils or 10 mils, but when you do a procedure, whether it's a bladder procedure or a prostate resection procedure, you put a catheter where you actually inflate it to 20 mils. So if you go to the local clinic and they're expecting to draw 10 mils and then the catheter comes out, they're pulling out the catheter with 10 mils still in the bulb. That's going to cause injury, and unfortunately that could lead to urethral strictures, and that's it's very unfortunate. Yes.
My father, he was very stubborn. He tried to yuck out his catheter and didn't know that you have to move the liquid in the. You understand what I'm saying?
I mean, there's some individuals who
inserted the catheter and he put the fluid in it and it was in the wrong position, and I told him that, and I didn't go home because you and someone else was in there, and I told him that my body is smaller than him, and you actually believe that catheter was in the incorrect position when I went to use the bath.
Yes, so if you have a massive prostate, sometimes the catheter is curling inside the prostate, and if you inflate it, you're going to cause horrible torrential bleeding and everything else. But I thank you for the call. We're coming to the end of the show. I thank for all the loyal listeners, and I hope that I'm able to improve the quality of life of many individuals. And please do not let the bladder control your life. Stop living your life in darkness. Here to help. Have a good evening, Bahamas, and see you next week.
Rise up again. Let nothing keep you down. Live your best.